Hi-ya! Well, now that we understand how the electricity flows through the heart and how it causes contraction, we're ready to look at heart blocks. So what is a heart block? Well, there's three types. There's first degree, second degree, and a third degree heart block. And what is a block? Well, it's just an impedance of the flow of electricity through the heart. And of course, that would result in some sort of problem with a contraction. So when you have a heart block, yes, it's going to take more time for the electricity to get from one bump to the other on the ECG waveform. So it's going to result in a delayed contraction, but it could also result in a missing contraction altogether. And that's why we get concerned about heart blocks. If the electricity is impeded, not only will it take time, causes some discoordination in the heart, it could actually result in the heart not beating properly, and that means blood's not moving. And the degree of heart block is a degree of severity. So that's why we want to take a look at the first, second, and third degree blocks. Now, admittedly, this area is a little bit nerdy, so just as we have to do sometime, make sure you go get your nerd glasses so we can study first, second, and third degree heart blocks. Let's take a peek. Okay, our first check is a first degree block, and this is when it takes just a little bit too long for the electrical signal to get from the atria, which we associated with the P wave, to the ventricles, which we associated with the QRS complex, or the contraction of the ventricles. So normally this distance is not going to be too long. It should look something like this. As you look at this, what you'll see here is that the distance between the P wave, and I like to look at the end of the P wave. Technically, you're supposed to look at the middle or the start of the P wave. It's called the PR interval. That definitely gets a little bit nerdy. But the distance between these two parts is supposed to be really only just a couple of those small boxes wide. But if this gets to be greater than that, if it gets to be somewhat of a distance between the P wave and the QRS complex, then that's when you have a first degree block. Okay, so what do we do for treatment of a first degree block? Well, basically nothing. And that's because there's really nothing that we can do about it. This is especially true if the patient is asymptomatic. If they feel fine, they're going about life. In fact, some people walk around with a first degree block. All we do is just note it that the patient has a first degree block. And probably on some level what we're concerned with is that someday that could switch into a second degree block, which we'll talk about in a minute, but is more harmful, or a third degree block, which is actually deadly. So that's what we're concerned about. But some people walk around with a first degree block for years, and they're asymptomatic, and so there's really no treatment for that. Now, moving on to a second degree block. A second degree block is where things start getting very interesting. First of all, if you have a second degree block, you probably also have a first degree block. So the time between the P wave and the QRS complex is probably increased. It's taking a little bit more time. What happens here, though, is that all of a sudden in a second degree block, a P wave will fire, and you're expecting a delay before the QRS complex happens. But in a second degree block, every once in a while, the QRS complex doesn't happen at all. It just gets skipped, and it looks something like this. Notice here on this rhythm that everything looks pretty fine. You do have a little bit of prolonged area between the P wave and the QRS complex, but all of a sudden, and every once in a while, it's intermittent, a QRS complex will go missing. Now, there are some complexities. If you're into ECGs, we can sometimes look at that and see if there's a pattern. We'll look at, is it missing every other, every third, every fourth? Is there a predictable pattern, or is it completely intermittent random? And there's names for all of that. I'm not going to go into that because, one, that's too much nerdy for us, and because that's what a cardiologist would worry about. And of course, the best reason is because we don't see that kind of depth on the NBRC exams. But you do need to notice that when there's a missing QRS complex, and notice after that missing QRS complex that the P wave will just fire again, and then hopefully the QRS complex goes back. So again, this is not a deadly thing. The patient's not about to keel over because they have a second degree block. They may even be sitting there asymptomatically watching something on TV while you're doing it and laughing at a sitcom, and you know that everything's okay. But our primary concern here is that they could slip into a third degree block. And so if that happens, that's a deadly rhythm, which we'll talk about in just a minute. But the treatment for a second degree block, to understand that, we do need to understand what a third degree block is and how to treat it, because those two things are related. So let's now move on to a third degree block. Now, to understand a third degree block, well, probably the best way is just to show you what it looks like. So let's take a look at this static third degree block. Right? As you look at that, you should be thinking, what the heck is that? Where's the P wave? Where's the QRS complex? Where's the T wave? Where are all the bumps I'm supposed to see? The truth is they're all there, but they're on top of each other. This is when the heart's electrical signal is firing everywhere and with no coordination at all. Now, normally, if you were to look at a heartbeat, it would look like this. The heart would just beat just like this. But if you could look at a third-degree block, the heart looks more like this. It looks like it's kind of just jiggling. The parts of the hearts are kind of jiggling. But what's not happening is there's not an effective contraction, and so no blood is being moved. And that's why a third-degree block is deadly. Now, the treatment for a third-degree block is external cardiac pacemaking, or a pacemaker. And this is where we put patches on the patient with wires attached to a machine. It detects some signals there, and it just gives the heartbeat to them. It originates the original beating pulse or the electrical signal so the heart can receive that signal. So that's the treatment for a third-degree block. But now let's go back, because remember, we haven't defined the treatment for a second-degree block. Remember, in a second-degree block, what we're really concerned about, the patient may be okay for now, but what we're concerned about is that they may transition to a third-degree block, which is deadly because blood is not being moved at all, or it's being moved very, very inefficiently. So the treatment for a second-degree block is very interesting. It's simply this, is to hook them up to the external pacemaker, but don't turn it on, don't activate it. One of the things we don't want to do is have somebody in a second-degree block and they slip into a third-degree block, and at that point, when we know it's deadly within just a couple of minutes, start looking on the crash cart for where are the wires, where are the patches, and hey, how come somebody hasn't charged this machine, and by the way, I have to plug this thing in. That's not a good time to do that. So in a second-degree block, the treatment, technically not a treatment that fixes them, but it just secures ourselves in case there's a third-degree block, is to hook up the pacemaker, plug it in, hook up the wires, put the patches on the patient, make sure we have everything. Just don't push the button to activate it. That way, if they slip into a third-degree block, all we have to do is reach over, push the button, or turn it on, and they're having pacemaker intervention for the third-degree block. And so the first-degree block, just in summary, is simply, it's just do nothing, just realize they have one. A second-degree block is whenever you start missing a QRS complex, in addition to the prolonged PR interval. And what do? Well, we hook them up to a pacemaker, wires, patches, but we don't turn it on. And then a third-degree block is we turn on the pacemaker and we pacemake that patient's heart. So that's how you treat a first, second, and third-degree block, and that's how you recognize them on the ECG waveform.